I go by Birdie. I am a clinical assistant professor, simulation nurse specialist. This is Sam Sanders' room. This little guy just had surgery. He had his appendix removed. He also has a history of asthma. And what the students do with this patient is that they do a full head-to-toe assessment, and this is before they set foot in the clinical setting. The benefits for the students for seeing Samuel first is that he speaks back to them. His eyes, they constrict. He has all anatomically correct heart sounds, lung sounds, bowel sounds, pulses. So what's fantastic about this guy is that the students are able to do a full-on assessment and really have an idea of what they could do in the real clinical setting. And here they also talk to Sam, where Sam responds, or he may act a little afraid or anxious and he wants his mom and dad. And so the students are also learning how to communicate with a pediatric patient, and so that they have an idea of what kind of resources are in the hospital that they could call for a patient that is experiencing a little anxiety, or how they would communicate with this patient to try to relax him, calm him, and maybe even have an opportunity to call a mom or a dad on the telephone. And so they're having more practice with communication with patient and patient family. So those are a lot of the benefits, and there are so many more. Oftentimes in the hospitals, students are only in an observation role with the nurses doing everything, and they're kind of standing back and watching. Here at ASU Hospital, our simulation center, they are making all the decisions. They are the clinical expert here. They're making decisions as to what they need to do with this patient. And here they are in a safe learning environment where they can make those mistakes if they were to make one, but they learn from them. And that's the benefit of simulation, and seeing Sam specifically right before they go into the clinical setting to meet pediatric patients.